Treatments for musculoskeletal care, in my opinion, will be first-line treatments in the next 5 years. I know this sounds shocking.
This is not an instant relief procedure. My injection is as important as what you're gonna do after the injection. And that you'll feel worse first before you feel better.
But you can't have a bunch of people that A, don't know about it, and B, don't want it. And all they want is their cortisone injection.
We need to believe in our abilities. We need to stop underestimating ourselves. We need to speak up. We need to demand a seat in the table. And we need to stop apologizing all the time. And sometimes you just have to sacrifice some things to be able to get where you want to go.
We know orthobiologics is the best treatment for our patients. But the question is how do you become successful? Hello, everybody. I'm so glad that everybody has joined us. I am so glad that Dr. Mary Ambach has joined us. She is not only a colleague, but a friend. And I am so blessed to have her with us tonight to answer those hard questions. So many of you may not know that she is the founder of her new office, BioEvolve, which I'm so proud and so excited to see. She is a specialist in regenerative sports and spine, which is rare. And she's passionate about musculoskeletal wellness and innovation. And she's also co-founder of the Women in Orthobiologics and Wellness. And for those of you who don't know me, I'm Dr. Ariana Demers, and I am a board-certified fellowship trained orthopedic surgeon and sports fellowship trained, as well as regenerative medicine, passionate expert. I previously president of the Interventional Orthobiologics Foundation, and I love to help doctors incorporate orthobiologics in their practice seamlessly. Yeah, so I think what I'll do is, for right now, we're just going to be flipping back and forth between this slide deck with the questions, and then we'll just go to just us chatting. So honestly, this is a fireside chat, and we're going to be exploring some more controversial topics. And this is just like friends that we always sit down and get kind of nerdy and really talk about those more controversial, the things that maybe aren't said in meetings. And so I wanted to invite you guys here today to kind of listen in on our conversations on the spicy side of orthobiology. And hopefully we can gain some actionable insights to implement in your practice starting tomorrow. So there'll be a question and answer session at the end that you can ask Dr. Ambach or myself any questions that pop into your head, and we'll just have a conversation. So, treatments for musculoskeletal care, in my opinion, will be first-line treatments in the next 5 years. I know this sounds shocking, but this is my vision and my dream that orthobiologics will be the first-line treatment in 5 years. And if and only if you fail orthobiologics, will be a candidate for surgical intervention. The train is leaving the station. And if you are not actively offering these treatments to your patients, you got to get on the train. So join us, and we're going to explore how we successfully integrate orthobiologics. Sometimes it's hard. Sometimes people say, well, yeah, I don't know the science. I don't know the technique. I don't know cash business. I don't know marketing. I don't know sales. And that's okay. We know orthobiologics is the best treatment for our patients. But the question, how do you become successful? Maybe you've tried some things. Maybe you've tried some marketing. Maybe you've taken a business class. Maybe you're going to IOF and getting buffed up on all of the techniques and the science. But it's really not your fault. Because we didn't learn business in medical school. Maybe some of you are struggling on how to be more successful and capitalize on this $4 billion orthobiologics market out there. So who today thinks that we deserve more and we deserve to make it easy? So just pop in the chat what you're struggling with most, and then we can kind of go into why this is so hard and maybe what we can do to make it not so hard. So how do we win, right? We're all winners here. How do we win at this piece of the puzzle? And while we are talking about the science today, we also need to consider how we talk about this with our patients. So your patients win, so we win as physicians and have happy patients, happy doctors. So the way we win is you need a system. And today we're going to be talking about orthobiologic knowledge. And so we're going to get going on this journey a little further. But in order to be wildly successful, you need a reproducible system that goes over all the right things. So let's get down to business. And the reason we're here to ask Dr. Ambach all the hard questions. So, Dr. Ambach, women in regenerative medicine, why is this such a conundrum? How have you found success in breaking down barriers and leading innovation? Because for me, I have struggled. So I would love for you to kind of share your experience and what has allowed you to be so successful.
So first of all, very fitting. Yesterday was the Women Physicians Day, I believe. And so belated Happy Women's Physicians Day. I think women in regenerative medicine is the same as women everywhere else, in different industries, in different businesses. I'm definitely no expert in this topic, but I can only speak from my experience. Fortunately, I would want to believe that in the 21st century society, the people in the society is being more aware of the importance of, diversity, equity, inclusion. And at least from my experience, more and more men and women, are being supportive of women co-workers and their spouses. So we still have a long way to go, but I think we're headed in the right direction. There's obviously external and internal barriers, but from my observation, I think women need to overcome internal barriers more so. We need to believe in our abilities. We need to stop underestimating ourselves. We need to speak up. We need to demand a seat in the table. And we need to stop apologizing all the time. And I'm guilty of this. I always say sorry for, everything. But at the same time, we also need to embrace our ability to, being empathetic, having attention to details, being collaborative and inclusive, because this is what makes us unique and special. So with regards to regenerative medicine, my experience has been, that great in a way, a lot of learning experiences. I was in a predominantly spine MSK chronic pain practice for about 7 years when I realized that I have to do something better than giving steroid shots for my patients every 3 months. And so that's when I started to research and learn about other things to basically improve my patients' success and outcomes, at least in the spine world. So that's when I started to learn about PRP. And I saw an opportunity in LA. I'm practicing in San Diego at this time. And I saw an opportunity in LA at the Ortho Healing Center to spend a year with them and get more training there. And so I stopped my private practice to get more education, to get more learning. And sometimes you just have to sacrifice some things to be able to get where you want to go. And so literally in 3 weeks, I found a school for my kid, I found a place to stay, and I was in LA. And I'm very glad that I did that, because I was able to network and collaborate with national, international big players in the regenerative field. And I learned a lot. So the first thing that I would say to break barriers is to really invest in your education and your skill development. And that's a continuous process. Until now, you and I, Ariana, we're always, in conferences learning with our colleagues. We're always trying to learn something new. Second thing that I would say is to participate in advancing the research. I know PRP, regenerative medicine, is not new, but with regards to orthopedics, we're relatively new. And so we need to participate in clinical trials, which it's not easy to do, especially when you're in private practice, but you just have to put in your schedule. Maybe do like an hour, 2 hours a week to devote your time to publishing research, writing book chapters, writing articles. You got to participate in advancing research. And that's also how you get your name out there and be recognized. Another thing I would say is to collaborate with across disciplines. My specialty is physical medicine and rehab. And so I am lucky enough to have the opportunity to naturally have that collaboration with a lot of different disciplines and providers, orthopedic surgeons, physical therapies, occupational therapies, and the neurologists, rheumatologists. So it made it easier with my specialty, but you got to get out there to collaborate across all the disciplines, not just to enhance your specialty, but also to learn about what they can contribute to the field, right? Orthopedic regenerative medicine is multi-specialty. And I think that's how, we can move forward, is if we all work together. I don't know if you remember, Ariana, when you were, inducted as the president of IOF, I wanted to seek representation for just us women physicians, and just to be able to connect with someone with, the surgical field. And once you got off that stage, I ran to you and I was like, let's start Women in Orthobiologics and Wellness. And that's basically, how we started this group. But you got to seek representation. I know sometimes it's nerve-wracking to go up there, speak up in the stage or do webinars like this, but we really have to do it to inspire other women in regenerative medicine to do the same. Seek out mentors. Seek out mentors. I'm lucky enough to have a lot of peer mentors with, Chris Rogers, Donnie Buford, Steve Sampson, you, Ariana, Anu Navani, a lot of peer mentors that I learn from every day. And so that's really, really important to do. And then I think last thing that I want to say is to get involved in the community. That's how you talk to, regular people out there about PRP. I'm surprised every day that patients come in my clinic and they tell me, why did my doctor never told me about this? Or, I never knew about PRP, and we've been out for decades. And so for me, my passion is medical mission and really helping out, reaching out to less advantaged communities. So I'm a member of Orthopedic Human Initiatives, which is a nonprofit organization that provides primarily orthopedic care in the Philippines. And so I work with sports medicine docs from Mayo Clinic to do mission, conduct educational conferences to the local docs on regenerative and sports medicine. And I also get my son involved in volunteering and participating in medical missions. So we volunteer, every few months or so, but just getting out in the community to talk, not just about, what you do, but just, little things that you can help them with their low back pain, or, you always talk to them about little things like that. What do I do? I mean, obviously you're not going to give a consult, but helping them, but at the same time, spreading the word with regards to what other options they have out there. And so there's a lot of ways that you can do it. You just have to, put that in your vision board, put that in your list of things to do, make time for it, and, just do it. It's hard.
Words of wisdom. Holy cow. What would you tell somebody? Because I really struggled with this being in private practice in a small town. What's the next step to be able to participate in research? Like, if you're not in this realm, you don't have mentors who are running research projects. You're not being sought out by FDA trial companies. What's the next best step?
I would say look into the organizations, in your specialty. Majority of the time, they do have in their websites, a call for anyone who's interested in participating, in certain activities. And I think that would be the first thing that I would look at is your specialty organization. And then regenerative specific organizations like IOF, TOBI, as you know, with IOF, we do have a research focus. And so we always encourage fellows and other physicians to participate. And that's how you can kind of connect with those people. Those are the two main things that I would start with, other than, again, just going to conferences, meeting people, and talking to those who are the experts in the field that you want to do research on.
Right. Great. Awesome. Thank you so much. Yeah. It's been daunting for me. And while I do have research projects, being in private practice is hard. To set aside that time when you feel like you're just like cranking through this, and research is not a revenue generating experience. I know that, but it is a necessary evil, and it's a way to drive the field forward. And I think you can just as easily just start with a question that's burning in your mind, like, why do we do it this way? Or, what if we did it a different way? Can I compare the two, with or without this, with or without that? And just do a data collection of your patients. I think that's also valuable.
Right. So I'm glad you mentioned data collection, because from that, you can really generate a lot of questions just from the data that you collect. And then you can reach out to your peers and say, hey, these are my outcomes. Can we put together our data and write something about it? So that's probably the easiest way for us in private practice to get something out there.
Yeah.
That can be published. Yeah.
Yeah, absolutely. I will say one last thing about data collection and publication. These days, you have to have some kind of IRB if you want to have peer-reviewed publications. I think the easiest way is to have a data collection agency like RegenMed or Data Biologics, so that because they do have retrospective IRBs for both of those companies, so that any data that you collect is then can be de-identified and used for publication. So I think that's one maybe easy way in, is just collecting your data, which we all should be doing anyways, and then using it for publication. Awesome. All right. So we have questions. We have more questions. So the use of orthobiologics in acute and chronic injuries, does timing matter? Do we need to get all of these people in right away? Or should we let everybody wait 3 months, see if the body will heal itself? Or is the answer somewhere in between?
That's a really good question, because that's probably one of the more common things that I get asked as well, with my patients, is when would be the best time for me to do the procedure? As for all of us who are doing these procedures, as we all know, the way that cell therapy, PRP, treats injuries, whether they're acute and chronic, is the same. They help accelerate tissue repair, they help regulate inflammation, they help decrease all the inflammatory mediators that causes pain and tissue breakdown, at least over, inflammation. They do help with nerve pain by decreasing this nociceptive signaling by either decreasing inflammatory mediators or desensitizing nerve endings. And so the pathophysiology is the same in how the cell therapy treat acute or chronic pain. I think for me, the timing matters, depends on the goal for the treatment. Like, for example, if a patient comes to me with an acute radiculopathy, the primary goal for that is pain relief. And so my treatment will be different with this patient compared to a patient whose goal is to be able to get back to playing pickleball, for example. which is probably, a good candidate to do cell therapy on. And so I would explain it to the patient with regards to the timeline for pain relief after PRP therapy. So I would explain to them that, okay, the first 0 to 3 days, maybe 5 days, there's going to be an inflammatory phase. You're going to have mild discomfort. You're going to have swelling. You're going to have stiffness. So if you're in a lot of pain, this is probably not, the best time to do it. Although, there are some patients, because of that anti-inflammatory effect, sometimes they do get some relief. It's a modulation of the inflammation. There's some inflammatory, there's some anti-inflammatory. But generally, you feel worse first before you feel better. And so I would offer other options for those patients who are in acute severe pain, whether that's shockwave or prolotherapy or something else. Or, just give their body time to heal. Give them time to heal. Usually 4-6 weeks, even longer. They can do physical therapy. They can do rehab. They can do other modalities that can help their body to heal. And majority of the times, the patients will understand that, and they would want to go that route. And so I would explain to them how PRP works, how cell therapy works, and that will determine our course of action. And that's really where timing matters for me. That's how I determine, when to do cell therapy. Now, I would have patients that would come with, let's say, an acute partial tear, let's say, of their supraspinatus, and they tell me, I'm in a lot of pain, but I can handle pain and I want to treat this now. That may be a patient that, even if you tell them, well, maybe, let's see how your body heals you and give it a little bit more time. If they know what the expectations are, they are willing to do it now, I would consider doing it. So it's really an open communication within you and the patient with regards to their goals, what the expectations are, how the cell therapy works, all that stuff.
I'm going to give you one more question in this idea. Like, what do you tell your patients as to why they have this chronic injury? Like, why didn't it heal? Why didn't the body heal itself? What do you tell them?
Right. So for example, for tendons and ligaments, I would tell them, one of the reasons why is there's not a good blood supply to these regions. And so the body does try to heal it, but it does an incomplete job of healing your injury. And so that's why we see tendon injuries all the time, and there's also, you're using it every day too. So there's also supply and demand. If you've got a high level of activity, you're lifting weights every day and you're not giving your body a chance to heal, that's also one contributor of why it's not healing very well. Medical comorbidities, like diabetes, poor nutrition, things like that can also affect the ability of your body to heal. And so there's several reasons why it doesn't heal. Some patients are open to just giving it a little bit more time to see, how much improvement they get. Some patients are not so, and they want to act on it right away. So again, going back to, goals and communication, and basically they get involved in the decision on how to go about their care. Most of the patients come to me and they just know what they want. I've researched PRP, I've researched stem cell, this is what I want to do. And as long as we manage expectations, we basically they know their bodies better than we do. And so we just kind of do a treatment plan based on that.
Gotcha. Speaking of managing patient expectations, how do you use the art and the science to manage your patients' expectations for PRP, BMC, MFAT? How do you, because, we all have those patients that come in and expect that this stem cell therapy is going to be curative. And so how do you kind of lay crepe, but also we're in the business of selling this procedure. If we don't sign them up for this, we have less money in our bank account, and they're in there asking for it. So how do you manage both the desire to help and the expectations that maybe are a bit overzealous?
Right. That's always, an art, as you said. But you just said the first important thing when I talk to my patients regarding managing expectations is that PRP or stem or cell therapy, it's not a miracle cure. Although it can aid in tissue healing and pain relief, it doesn't guarantee that it will cure your disease or, create full recovery of your condition. So I always tell them, especially for my patients who's got moderate to severe osteoarthritis, this will not get rid of your arthritis. It might improve the quality of your cartilage. It will improve your pain and function based on a lot of studies that has been published, but it's not gonna probably make your MRIs better, And then their next question would be, well, there's some studies that has been published with before and after MRIs with, improved changes in the cartilage quality, or even second look arthroscopy wherein they showed some improved cartilage quality. So there's that, but I can't guarantee that that's gonna happen in this scenario. I can tell you there's probably a 75% chance that will be successful for your mild to moderate osteoarthritis, worst case scenario, if you do all the right things. And so just kind of feeling out the patients, because as you said, there will be some patients that will come in the clinic and say, you're going to regenerate my cartilage, you're going to get rid of my osteoarthritis. And those are the ones that you got to kind of squash right away. You got to tell them, no, that's not what I'm going to do, but this is what I'm going to do. The other thing that I tell my patients would be that this is not an instant relief procedure. This is something that will result to gradual improvement, that it might take 2, 3, even 4 months for you to get the full benefit from it, or even later, especially for spine. And that, you'll feel worse first before you feel better. There's a few days, maybe 1 week, if you're really sensitive, that you're going to feel more achy than your normal regular pain. So if you're okay with that, then this will be the treatment for you. Because once you get to that point, you'll be good until you injure yourself again. There's more longevity to your treatment. The structure or the body region that we are treating will be stronger, will be more stable, so you're going to be able to do more. So kind of balancing the expectation and also what the treatment can do. You still tell them that, this is better than whatever we have right now. We're going to inject you cortisone, you'll feel great for 2-3 months, but then you'll be back and your cartilage, your knee joint is probably worse at that time. So just kind of balancing that. And again, feeling out your patients. Some patients will hear what they want to hear, and those are the ones that you're just going to have to repeat to them what the expectations are for the treatment.
Yeah. What do you tell your patients? Yeah. They always want to know, well, how long is this going to last?
Right. So for my severe arthritis, for example, because that's the most common thing that we say, I would say worst case scenario is probably about a year, because that's what my outcomes are, or that's what the studies are saying. If you're using MFAT or BMAC, worst case scenario, I would think, is probably like a couple of years. And for PRP, is probably a year.
Yeah.
So that's what I tell them. And then they have individual responsibility as well. I tell them this works best if this is a part of a comprehensive plan. My injection is as important as what you're going to do after the injection. You're going to participate in rehab. You're going to have a gradual return to your exercise, nutrition. You have to have that commitment to your post-procedure care. And so that's kind of one of the things that you need to hone into your patients, because some of them will just want to do the injection and then they go back, sit in the couch and watch TV. That's not how it's going to work. And so, so those are the things that I usually tell my patients, as again, depending on where you live and the kind of patients that you see. Some patients come to your clinic and they've read a lot of stuff already, and so you just focus on the things that they have questions on, and that way you don't spend too much time on things that they already know. The first question that I ask after examining them and getting their history is, what brought you here? And that question really opens up a lot of things with regards to helping you focus on what to discuss, because you can discuss stem cell therapy and PRP with them for hours, but depending on the reason why they came to see you and what their goals are, you can kind of hone in on the discussion. That will help a lot.
So from a business perspective, are you offering these as standalone treatments? Are you offering packages with the other wellness pieces to it? Are you optimizing nutrition? Kind of walk me through how you take care of your patients from a business perspective.
Yeah, so I have shockwave machine in my clinic, and so a lot of my soft tissue injuries, I do have encouraged them to do that shockwave therapy as a part of the treatment. If
In
they have,
addition to,
in addition to,
okay,
yeah, in addition
okay,
to, especially if they have calcifications, I kind of want them to finish that shockwave therapy first before doing the cell therapy. I work with a lot of naturopathic that can help me with that nutrition aspect. Eventually, I do want to learn more about that and incorporate that in the clinic because that's really, really important. So I can answer some of the simpler questions that my patients tell me. I've got websites for them if they have questions on supplements and all that stuff. But if they get into the details, then I refer them to my naturopathic docs who probably know more about me on this. But that's something that we need to learn more if we are going to be good at treating these patients.
yeah.
So really that's it. And then I have established a relationship with good physical therapists, soft tissue workers, sports chiropractors, such that I can match the patient with the right provider. Some physical therapists have specialty in other things, so you can kind of match them. And that's how you get their buy-in in doing the therapies. Because otherwise they're not going to do it.
Right.
So matching them and also the location, you got to make it easier for them to be able to do it.
Big red easy button, right?
Yes, correct.
Exactly.
Yes.
We still have more questions. So I'm so glad that you brought up this volunteerism that you're cultivating in your son and that you do. And I know you've traveled a lot with all of these medical missions. But the question is, ethics of regenerative medicine pricing. How do you ensure accessibility without sacrificing quality? How do you ensure that those people who can't pay because it's not covered by their insurance can actually have access? How are you solving that problem of equity in your practice?
Right. There's always those ethics of, as you said, accessibility versus, quality of care, just being able to do it. And the price, and sometimes high price, can limit access for lower income patients. And so there's concerns raised about healthcare equity. So there's several ways that you can do it, and I do it in the clinic. So number one is you can offer payment plans, and that can make it easier for them to swallow if they pay little chunks every month or so. So that's something that you can look up. There's several ways of doing that, and so I'm researching the best payment plan that I want to integrate, because the ones that we used before I don't necessarily love so much. But that's one way. Number two would be to maybe have like a tiered pricing and offering some sort of discounts for patients who have probably do it as a booster shot. This is the second time they're doing it on the same body region. Then you can have either a discount pricing or a package pricing. And another way, and which I have done and enjoyed in the past, is to do like partner with some organizations. Like I participated in warrior to warrior programs wherein we do pro bono work for the military servicemen, and see whatever your practice can accommodate, maybe 1 or 2 a month, have like a pro bono day, and just kind of partner with organizations like that, or veterans in pain, and help like that. Another thing that you can do is to do maybe like at certain times of the year, do significant discounted rates for, again, in the same topic, because I'm in San Diego, so we do have a lot of veterans. So let's say a Veterans Day, do like a significantly discounted rate for people in the military, or Thanksgiving Day, do, again, like a program or a promo with significant discounts for patients who you feel will benefit most from the treatment. And so there's several ways that you can do it such that you can still incorporate like an ethical business model that can include compassionate pricing or service to people that you think will benefit. I mean, at some point, there has to be some cost sharing initiatives if we want to make this, like a bigger program. At some point, I think the government or some other nonprofit funding should be incorporated to help subsidize regenerative medicine for wider use. But yeah, there's always this balance of innovation and accessibility that's kind of hard to do. But that's how I would think we in the private practice can do it in our simple ways.
Yeah.
Cost is always hard topic.
I know. I've actually incorporated a patient-driven scholarship fund, and we offer everybody who is already paying for these procedures at their follow-up. We just let them know that we have a scholarship for those who may not be able to afford it and would they like to contribute. And then when we have those patients who would benefit from it but just absolutely cannot afford it, then we take the scholarship and we apply it to the patient bill. And if it doesn't quite cover, then, that's where we just make a donation from ours, like a matching donation from the clinic. Now, it's not certified. It's not, we just have it in a fund.
Yeah.
Account.
And that's the fun thing in private practice. You can be creative in any way that you can with regards to helping patients. Yeah, there's several ways that you can do it. At the same time, patients understand that there's a cost to high quality care. And that's the reason why a lot of patients are doing concierge medicine, as their primary care providers or direct specialty care, because they do understand that you get what you pay kind of deal.
More now than ever, I think.
More now than ever, for sure. Yeah. And your prices will reflect this. Like, for example, I invested in a lot of different equipments to make sure that I get the best outcomes to justify my costs, right? I invested in a cell counter. That way I know exactly how much I'm delivering to my patients and improve their outcomes. I invested in a biosafety cabinet or a laminar hood so that I know that everything is done in a sterile, clean environment. I invested in a fluoroscopy machine and an ultrasound machine so that everything is precise in the delivery of the cells. And then there's also staff training, and there's also your continued education. So all of this will help you get to a better outcome, which will translate to that cost that the patients paid. If they have better outcome, then they will be happy for the service that you provided for them.
Yeah, that's such a great recognition of like, it's not just the price of the kit. It is so much more than the price of the kit. And so when people are charging, just like whatever, 2 times price of kit, that doesn't cover the cost of all the things you just listed. And so people always are balking at like, that sounds so expensive. Well, an ultrasound is really expensive, and so is a C-arm, and so is a cell counter. Like, those things are not cheap. My shockwave, all of those things add up, and it is an investment, and it is something, I've done the same thing to stack the deck in the favor of the patient best I can. Data collection, I've done all the investment, so I know exactly what I'm doing, and I can tell them exactly what you can expect from me with all of my precision, all of the things that I know how to do, because I collect the data, and I can tell them, I can show them, hey, for the last 3 years, last 4 years, this is what the data shows for people just like you. And so I think I'm so glad you brought that up from a cost perspective as well. I am going to just talk a little bit about so what is that next step in having successful practice, right? You need to attract the right patients, right? So you can't have a bunch of people that A, don't know about it, and B, don't want it, and all they want is their cortisone injection. So you have to have a way to be able to have the patients that are excited about it, really ready to move forward. And so for this knowledge, we need the right ones who need your help, right? They have the right diagnosis, the right mindset, the right knowledge to be able to say yes. So for that, I have a little thing I'm doing this Saturday. I wanted to invite you to check out my workshop on how you actually find the right patients. So there's a QR code. I'll drop the link in the chat as well. And just register. It is at 8 a.m. on Saturday. Sorry, guys. That's PST, 11 a.m. EST. So I just wanted everybody to be invited, and hopefully you guys can make it. And we'll see, hopefully, everybody on Saturday, and we'll go from there. So if you want the fast track, I do have a proven method. So currently you're like, okay, great, but I want to know, more. We have Bob Live at IOF. So any of you who are going to the IOF event at the end of February, Bob Live is the business, a whole day of business to take your practice to the next level and go home and apply these strategies on Monday. So I'm going to invite you guys to come and do that. If you are going to be there, I'd love to see you. It'd be so great. So come on down. We'll be there all day. It's Thursday right before IOF. So take the day, come get some education, get some planning, get a roadmap to success, and we'll see you there. The early bird is still going. The VIP, which is a strategy lunch with myself, only 10 spots, so we got to keep it small. And so I also wanted to bring you to the women physicians in orthobiologics and wellness. So for those of you who have not joined, that is a QR code that if you can scan, then that's our Facebook group. And we're always on there sharing questions, sharing answers, experiences, and we'd love to have you join. It is for physicians only, and we like to keep it at that group. So I just wanted to invite you. Thank you so much. And then I'm going to open this to the chat. Please don't hesitate to put your questions in the chat over there. And Mary, thank you so much for the time. I'm honored to have you on our webinar. It's really great. I love chatting with you. It's so fun. So if there's any questions, anything you guys are wondering about or worried about, or just have a comment, I'm sure everybody else has the same question. So just let me know in the chat, or you can just unmute yourself. I guess I can unmute everybody else. Actually, I don't know how to do that. But you can raise your hand also if there's something that you're wondering about. I do have one other question. When you were talking about like a touch-up, do you include that with all of your patients? Do you have a certain subset of patients that always are in the realm for touch-up?
Majority of my patients who do need a series are my spine patients.
Okay. Tell me a little bit more about that.
Yes, because almost always the patients that I see with spine issues have multi-level, multi-structural involvement. And sometimes it's just hard to get it all in one session, although you're already doing like 20 shots in one session.
Right.
Yeah, sometimes they do need to come back to get that done. So I can kind of identify those patients that I know would need a second or a third. And so I would price it as such. If they're coming, in a series of 2 or a series of 3, then, they will have a better price than, if they just do it one at a time.
And how far apart do those, are you putting those? Are you
signing
them up for a series of 3, and then if they're great, they kind of
for the spine, usually I do it every month because I've done it before as early as the 2nd week, and they're still kind of a little sore from that treatment, especially.
I've read some studies that show that if you repeat the epidural at 6 months, we have better outcomes. Is that something that you found?
I mean, if I'm going to repeat an epidural, I'm going to repeat it way sooner than 6 months. I'm not going to wait for 6 months. The only patients that I would probably wait for 6 months are those kind of one level, epidural, wherein they have one disc herniation that's impinging on one nerve root. Then yeah, let's give you a good number of platelets in that level, blast that area, and then, come back. Usually my follow-up is 4 to 5 months just to check in for spine. And then if they are not quite where they want to be, then we schedule it for a booster shot.
Gotcha. Awesome. All right. So any other questions? Let's see. I don't think I see any. Well, that has been great. This is going to be your last chance to have a fireside chat with Dr. Mary Ambach and myself. So any burning questions, things you're wondering about either in private practice, in business, in treatments for our patients, how do we talk to our patients? By all means, don't hesitate to just pop that in the chat or raise your hand and we'll come get you off of mute. If no one has any questions, thank you. I really appreciate your time. That was super fun. And I will see you in a couple weeks at IOF or days. And hopefully I'll come down to San Diego and see your clinic. So I'm very excited. Oh, let's see here. Perfect. I'm going to let you go early. So thank you so much.
Thank you. This has been fun. Thank you for having me.
It's my pleasure. We'll talk to you guys soon. Thanks everyone for coming and taking time out of your day. We really appreciate it.